Ever wonder what it really costs to find a cure? Well, in the super high-stakes world of drug development, the price tag is frankly staggering, and the gamble has never been bigger. Today, we're going to dive into the revolutionary science and the massive investments that are literally shaping the future of medicine.
Okay, get ready for this number. $190 billion. That's how much the biggest pharmaceutical companies spent on R&D in 2024, just 1 year. But here's the wild part. That's not just a big number, it's a huge acceleration. It's a 73% increase from just 5 years ago. The industry is betting bigger than ever before.
And that brings us to the most important question of all, right? With all that cash pouring in, are we actually getting our money's worth? Is this incredible spending spree actually leading to incredible new cures?
To figure that out, we have to understand something really fundamental. The whole idea of what medicine even is. It's changing. We're moving way beyond the simple chemical pills that have pretty much defined healthcare for the last 100 years.
You see, for decades, the game was all about what we call small molecules, basically simple chemical compounds. But the new frontier is what the industry calls novel modalities. Think of these things as living drugs or biological smart bombs. I mean, with cell therapy, doctors can literally take your own immune cells, engineer them in a lab to become cancer-hunting assassins, and then put them right back into your body. It's a massive shift from basic chemistry to complex biology.
And you can actually see this pivot happening right in the data. If you look at the drugs that are in late-stage phase 3 trials, that's the last big step before they can get approved, you see a huge change. Back in 2015, those traditional small molecule drugs made up 58% of the pipeline. Fast forward to 2024, and that number has dropped all the way to 44% as these newer, more complex therapies muscle their way in.
And these aren't just numbers on a chart. This represents real, life-altering treatments. I mean, look at Casgevy. It's the very first approved therapy using CRISPR gene editing, and it offers a potential cure for sickle cell disease. Or how about Amtugvi, the first T-cell therapy to successfully treat a solid tumor, which was a huge barrier. But maybe the most stunning of all is Lenmeldy. It's a gene therapy for a devastating genetic brain disease. And get this, an incredible 85% of kids treated with it have achieved normal IQ scores. That's an outcome that was completely unthinkable just a few years ago.
Now, this new wave of science isn't just for rare diseases. It's also being deployed in one of the most urgent fights we face, the battle against antimicrobial resistance. The rise of these so-called superbugs threatens to undo a century of medical progress and make common infections deadly again.
This quote from Pharmacy Times just hits the nail on the head. It's a relentless arms race. As soon as we develop a new antibiotic, the bacteria start evolving ways to beat it. We have to keep innovating, faster and faster, just to stay in the fight.
So just how serious is this? Well, according to the CDC, 2.8 million Americans get hit with an antibiotic-resistant infection every single year. This isn't some distant future problem. It's a clear and present danger happening right now.
But just as the enemy is evolving, so are our weapons. In this arms race, scientists are developing a completely new generation of antimicrobials, smarter drugs designed with brand new ways to outflank and destroy even the most resistant superbugs.
And here's where it gets really clever. Take a drug called gepotacabtagene. This is what's known as a first-in-class antibiotic, which basically means it works in a totally new way. It attacks how bacteria copy their DNA through a novel pathway, so it can kill bugs that have already learned to resist our older drugs. It's a completely new line of attack, and it gives us a crucial new oral option for some really tough urinary tract infections.
And then you have Sulopamine. Now the Penem class of antibiotics. These things are workhorses in the hospital. They're incredibly powerful, but you've always had to get them through an IV. Well, this is the first time that power has been packed into a pill. This gives doctors a vital new weapon they can prescribe against tough urinary tract infections, especially the ones caused by these highly resistant bacteria known as ESBL pathogens.
So developing these incredible new drugs is one thing, but the enormous cost and the decade-plus timeline it takes to get them to patients, that's still a massive hurdle. That's why the industry is now attacking the problem from a totally different angle, making the whole research and development process itself smarter, faster, and way more efficient.
And you know what? We're already seeing progress. Just by using smarter regulations, like the FDA's expedited pathways for really promising drugs, we can cut the average development time by about 3.5 years. That is a huge deal when it comes to getting critical medicines to patients who need them.
And this is being driven by a whole new toolbox of strategies. We're seeing more flexible clinical trials that can change on the fly, a bigger use of biomarkers to predict if a drug will work much earlier, and new tech that allows for decentralized trials. But the biggest game changer, the one everyone is talking about, artificial intelligence.
Yeah, AI is no longer just some buzzword in drug development. It is rapidly becoming the actual engine of discovery, and believe me, the industry is pouring billions and billions of dollars into it.
I mean, just look at these deals. Google's Isomorphic Labs signed partnerships with Eli Lilly and Novartis that are worth nearly $3 billion combined. Vantai and Bristol Myers Squibb have a deal for over $500 million. These are not small bets. This is a massive, industry-wide conviction that AI is going to fundamentally reshape how we discover and develop medicines.
So you have this incredible convergence, right? You've got revolutionary biological science, the predictive power of AI, and a massive $190 billion investment fueling the whole thing. And it leaves us with this one fascinating question. Are we on the verge of actually conquering disease, or are we just gearing up for the next, even more complex fight ahead?